my name is Dr. Valentine Gibson, and today I will be demonstrating the iPACK block, which stands for interspace between the popliteal artery and capsule of the knee. This is an excellent block to do as an alternative to a selective posterior tibial nerve block, or just a regular old sciatic nerve block whenever you're doing something such as a total knee arthroplasty or even an ACL repair. So it allows you to get local anesthetic to come into contact with the geniculate branches that innervate the back of the knee, and therefore alleviating some of that posterior knee pain that's so common after total knee replacements. So what we're going to do is we typically use a curvilinear probe because it is a deeper block, and we're just going to place it slightly above the medial malleolus. So this is the medial malleolus, or I should say medial epicondyle rather, of the knee. And so we just place it right here, just a little bit above. All right, and so you see I'm maybe a half a hand width above the medial epicondyle. And now we'll focus on our ultrasound image. And what we're really looking for is a nice demarcation of the posterior capsule of the knee, which will show up as a diagonal white line. And then we're going to look for the popliteal artery, so we can see it kind of pulsing and bounding there. So let's darken that image up just a little bit, Sam, see if we can get a little better picture for the folks there. That's pretty good. Okay, so hopefully you guys can appreciate that structure. The white line here, the posterior capsule of the knee, kind of a diagonal bright white line. And then we're going to see the popliteal artery pulsing. And we're just going to bring our needle in such a way that it comes right between those two anatomical structures, or the interspace between the two. All right? So you can see my point of needle entry here. And then now we'll turn to the ultrasound image so you can see what that looks like. So you'll see me kind of gently moving along the posterior capsule of the knee. I'm going to sharpen that image up for you a little bit. All right, now you can see me jostling my needle tip there, right there. You don't want to go more than a centimeter beyond the popliteal artery, because if you do so, now your local is going to have a higher likelihood of coming into contact with the common perineal nerve, and therefore you risk getting foot drop. So we're going to stop right about there. We're just a little bit past flush with the popliteal artery, and you can kind of see me jostle the tip of the knee there, the tip of the needle rather, and we're going to inject 5 cc's.
That's right.
Now the injectate's going to look a little radio-opaque right now, and that's because this solution has Exparel mixed in with the bupivacaine, so it has liposomal bupivacaine mixed in with regular bupivacaine.
5 cc's given.
So it'll appear a little bit radio-opaque, but if you were just using a regular aqueous solution, you wouldn't have that kind of distortion. So now I'm going to pull my needle back just a little bit. And again, you can see my needle tip there. I'm jostling. So now I'm in the middle part of the posterior capsule of the knee, and we're going to inject again.
Aspirating.
Perfect. And you can kind of see that interspace distend a little bit as we give our injectate there. Now you can see my needle tip here. I just pulled back a little bit more, and I'm jostling my needle tip just so you can visualize that. Give another 5 cc's.
Aspirating. Another 5 cc's given.
Perfect. And then we're going to give another 5 cc's kind of right here at the most medial portion of the capsule, and then we'll kind of withdraw a little bit and get some into the muscle and soft tissue.
5 cc's given.
Thank you. And that is how you do the iPACK.